Hello, everyone. This is Dr. Manjal. Today, I'll be talking about attention deficit hyperactivity disorder. Essentially, ADHD is a significant impairment uh, regarding symptoms of inattention, hyperactivity, or impulsivity, or all of this in a mixed manner. Some of the inattention kinds are when you lack attention, you're making errors, you're having difficulty in sustaining attention to your task or while you're playing. It is as if you're not listening to uh, what's being spoken to. You have difficulty starting and sometimes failing to accomplish the task as well. It's difficulty organizing task. Even if you can accomplish tasks, you might be more mentally exhausted as a consequence of exerting more mental effort. Additionally, it could be that you're losing your important materials and belongings repeatedly and just being forgetful. The other kind is the hyperactivity symptoms, which includes repeatedly fidgeting, having trouble staying seated or having trouble standing in certain situations, running and climbing inappropriately in context of the situation, finding it very hard to relax. Um, you also might have been told by other individuals to you that it seems that you are very hyperactive or you're very hyper. Some individuals might have told you that you talk too much or you have a verbal tendency to blurt out inappropriate things in context of your situation, having trouble waiting turns, being interruptive. Now, the important part is that we all may have these symptoms. The delineating aspect is regarding how many symptoms you have and for how long. So the duration should generally be around 6 months or more. Generally, the symptoms should be present before the age of 12 in at least two settings like school, work, home, or in social settings. There could be functional impairment that is significant, um, and you're struggling as a consequence of that. To meet the threshold to be diagnosed by ADHD as per DSM, you have to meet at least 6 of the inattention symptoms, or 6 of the hyperactive symptoms, or 6 of the combined symptoms if you're below 17. And if you're above 17, you can meet around 5 of these symptoms. And although we all possibly have experienced some of these symptoms to some degree, the fact that they persist for greater than 6 months or more. Now, the epidemiology includes that most of these diagnoses are made in childhood. Below the age of 18, around 7.2% of individuals are diagnosed with it. For adults, it's around 4.4%. Now, mind you, these are my notes from my research that I've obtained. Um, Research changes over time, and so will these numbers. And a lot of information that I may provide may change over time. Now that we have got the disclaimer out of the way, I'll continue proceeding. Generally, more males than females are diagnosed with ADHD, and one of the hypotheses is that males are hyperactive, which is very visible compared to females who can have inattention symptoms and can go unnoticed for longer. As for genetic transmission, individuals with ADHD generally have um, linkage with other individuals in their family who also have ADHD, and the risk for people who are born to ADHD families is around 5 to 10 times greater than the general population. We do not have any clear factors that cause these. However, it can be associated with low birth weight, premature birth, prenatal insults, or exposure to environmental toxins. Additionally, some of the hypotheses regarding what is causing these symptoms, particularly the pathophysiology of it, is that it includes multiple brain regions. Um, There's a delayed maturation of cerebral cortex in some, and sometimes even an overall reduction in the cortical volume by around 3 to 5%. There are some experiments that have been done, and they have showed alteration in the reward processing system, also alteration in default mode network connectivity. Overall, for the evaluation, generally we have rating scales that are validated, such as Vanderbilt, Connors. Some of the differential diagnoses that these individuals may have is oppositional defiant disorder, learning disorder, autism, intellectual disorders. Now let's talk about the treatment aspect. As for the treatment, if the individual is below the age of 6, then you try to have more behavioral treatments. These include psychoeducation, cognitive behavioral therapy, parent-teacher meetings, educating the parent, having school-based interventions, which in New York State might include like 504 plan or IEP plan. And generally the most successful outcomes are when you combine the pharmacological or medication treatment with the behavioral treatments. Now, if the individual is above 6, then you really start thinking about medications, because medications have shown to be more efficacious than behavioral or other interventions, although the best result is when you combine both the medication and the behavioral and the environmental treatments. The best medications, or the first line treatment rather, I should say, is stimulants, which include either amphetamine class or methylphenidate class. Now, interestingly, they come in short, intermediate, and long-acting forms. And these can be used depending on the patient's situation, but that's the first line. Now, prior to starting these medications, you should definitely screen for any pre-existing cardiac condition, any family history of cardiac death, and possibly even refer to cardiology. You should also monitor their blood pressure, heart rate, any other issues with decreased appetite or mood changes. Important thing to note is that long-term stimulant use, such as amphetamine medication or methylphenidate medication, may attenuate the deficits in ADHD. And it could be that it's making the individual practice behavioral trends and even neural connection enhancement that improve attention and reduce hyperactivity. Now, if the stimulants do not work, then there are also non-stimulant FDA medications, such as atomoxetine, which is a selective norepinephrine reuptake inhibitor, and it has been shown to be efficacious. Now, if you do start it, you should warn the families regarding possibility of increased suicidal ideation, which is a black box warning. Other medications include alpha-2 agonists, such as clonidine or guanfacine, but they are primarily used for hyperactive and impulsive symptoms, and their short-acting variations are also available. Lastly, the off-label medications include bupropion, modafinil, and they can also improve symptoms of ADHD. Tricyclic antidepressants have also showed some efficacy as well. This concludes a brief synopsis of ADHD and their treatments. And next week, I will upload another video regarding another psychiatric condition. I hope this was helpful. Take care.